My name is Melissa, and I'm going to be assessing the breast and axillary today. The first thing that I'm going to do is I'm going to look for symmetry in the breast. This is after I ask the history questions and the assessment questions, subjective. Then I'm going to be looking at the shape, if there's any redness, bulging or dimpling, her venous pattern, any skin discolorations, anything like that. And then I'm going to be looking at the areola, and I'm going to be looking at the symmetry, shape, color, smoothness, and size of those. And then after that, I'm going to be looking at the nipple, and I'm looking to see if it's inverted, if one of them is inverted or anything like that. And if it is, I will ask her if this is normal or if this is something new. Also, I'll be looking for discharge. Then I'm going to have her put her hands behind her head with her elbows bent like so that I can inspect that way. And then after that, I'm going to be having her put her hands on her hips and lean inward to where I can inspect her that way. And then the next thing that I'm going to do is I'm going to do the seated palpitation. And I'm going to start at the clavicle up here and kind of sweep down all the way to the nipple. And do the other side the same way. And then after that, I'm going to be doing the bimanual digital palpitation. I'm going to put my hand under her breast and palpate with 3 fingers across. And her other breast the same. And then I'm going to be checking the axillary lymph nodes. To do that, I'm going to have her lift her arm up, and she's going to bend her arm right here at the elbow, but I'm going to palpate right here, just under the first rib. And I'm going to bring my fingers downward and palpate softly there, right underneath that. And then I'm going to palpate the anterior and posterior axilla. Then I'm going to go down the arm and palpate all the way down to the bend of the arm and on back up. And then I'm going to go all the way down to the bra line underneath the axilla. And after that, I'm going to be palpating her clavicle up here, palpating across, and then in a circular motion underneath at the inferior clavicle. So on me, it would be like right here, palpating. Let's see here. And then a circular motion underneath the clavicle. Okay. And after that, I'm going to be having her lay in a supine position. I won't go all the way down so that you can see. And I'm going to place this pillow underneath of her, or a pad, and have her lift her arm up above her head. And then I'm going to ask her how she does her self-breast exams. And I'm going to do the exam how she does it, if she does it correctly, and show her the incorrect way she's doing it, or have her compare her exam to mine. And if she doesn't do a monthly breast exam, I'm going to show her the 3 different ways to do them. I'm going to show with a concentric circular pattern. Start there. Raise this back up so that you can see. I'm going to go in a circular motion, palpating around the outer breast, and then I'm going to go to an inner circular motion, and then the 3rd inner area, past that. And then also I'm going to show her the ventricle strip pattern, where I'm going to go down and up, starting at the edge of the breast, all the way across. And then I'm going to do the wedge pattern, where I start at the nipple and go outward to the end of the breast and back in different directions all around the breast. And then I'm going to tell her to make sure that she looks for the 5 things to look for nipples, which is discharge, depression, discoloration, dermatological changes, and deviation. And also I'm going to tell her whenever she does her self-breast exams to slide her fingers instead of getting up and moving the fingers so that she won't miss anything. And also that she needs to lift her arm up and do the tail of Spence too when she's doing her breast exams. And tell her that that's the most common area for lumps and masses and things, and that there's a lot of lymph nodes there. And I'm going to tell her that when she palpates the lymph nodes, that she needs to use different depths. She needs to use like shallow, medium, and deep depth at the different points. And then also that when she checks her nipple, she needs to compress with 2 fingers back into the wall behind the areolar, but she only needs to squeeze the nipple if she sees any discharge. And that the best time to do a breast exam is at the end of her menstrual period, usually like day 4 to 7. And then if she has any masses, she needs to note the size, shape, location, tenderness, retraction, and movability, and things like that with them. And then I'm going to tell her to continue to make sure she marks down her breast exam on a calendar every month and comes back and sees us for any issues.